So this video is to demonstrate oral medication administration using the 3 checks. So our first check will be in the medication room, second check will be outside the patient's room, and the third check will be at the patient's bedside. It is very important that you do all 3 checks. When we're giving medications, medication administration is an opportunity for mistakes to happen, and we want to have the safest outcomes for our patients. And if we are not being complete and thorough in our checks, we risk giving the wrong medication or giving the medication when it is not appropriate to give. So it is important to do every check every time you give a medication to a patient. So this first section is going to be demonstrating in the med room. Okay, so I'm in my medication room and I've pulled up my patient's MAR and I see that I have Phil Scherdoff, date of birth 1/6/1967. He has an allergy to shellfish, and it's 9 o'clock right now. I'm going to be giving him 2 medications that are due. The first is metoprolol, 25 milligram tablets, a dose of 50 milligrams orally, 2 times a day, one being now at 9. The second medication is his ciprofloxacin, 500 milligrams. It is a 500 milligram dose, given orally daily at 9 a.m. So I understand the patient is going to be getting the ciprofloxacin because he has pneumonia, and he's also going to be getting the metoprolol because he does have a heart issue, and so the metoprolol affects the blood pressure and the heart rate. And so we recently, 20 minutes ago, just did vital signs on the patient. His blood pressure is 120/80 and his heart rate is 84, and with both of those I know that it's appropriate to give his metoprolol. So we are going to go ahead and pull the medication. So the first medication I have here is going to be his metoprolol. So I have metoprolol. I have our patient, Phil Scherdoff, date of birth 1/6/1967, allergies to shellfish. The medication is metoprolol, 25 milligram tablets, a total of 50 milligram dose. So I have 25 milligrams, given orally 2 times a day at 9 a.m. I am looking, my package is intact, and my expiration date is 10/26, so it's okay to give this medication. My second medication I'll be pulling is ceftriaxone. Sorry, it's ciprofloxacin. This is why we use our medication MAR sheet. So I have ciprofloxacin, and I have Phil Scherdoff, date of birth 1/6/1967, allergies to shellfish. He is getting ciprofloxacin. Again, this is for pneumonia, 500 milligram tab. The dosage is 500 milligrams, orally, given daily at 9 a.m. It's the correct time. I'm also looking, my package is intact and my expiration is 12/31. So this is also okay to give. And then the other thing I need to grab out of my medication room is my med cup. And I already know from visiting my patient this morning that he does in fact have water at the bedside. So now I am ready to go and do my next check, the second check outside the patient's room. Okay, so now I'm going to do my second check for Mr. Scherdoff. So I have my medications here. I'm going to check again. I have Phil Scherdoff, date of birth 1/6/1967, allergies to shellfish. First medication is the metoprolol. So I have metoprolol, 25 milligram tablets. I have 2 25 milligram tablets. The total dose is 50, which means I have to have 2 tablets. The dose is orally, 2 times a day with 9 a.m. And it is 9 a.m., it is time for the medication. And then my next medication is ciprofloxacin. And the ciprofloxacin is for Phil Scherdoff, date of birth 1/6/1967, allergies to shellfish. Ciprofloxacin 500 milligram tablet. This is a 500 milligram tablet. The dose is for 500 milligrams. It's done orally, given daily, and at 9 a.m. And this medication is okay to give. And so now I'm ready to enter the patient's room.
Come in.
Hi, Mr. Sherdoff.
How you doing today?
I'm good. My name is Sheila. I'm going to be your nurse today.
Nice to meet you, Sheila.
I have your morning medications, okay?
Okay.
First off, can I see your wristband?
Sure.
And can you just verify your name and date of birth?
Phil shirt off.
Okay, and date of birth?
Sure. 1667.
And also, do you have any allergies?
Shellfish.
Okay, great. Thank you.
Sure.
And I'm going to just verify that on my MAR. And I see Phil Sherdoff, 1/6/1967, allergies to shellfish. All right, so I have 2 different medications for you.
Okay.
The first one is your metoprolol, and your second one is for ciprofloxacin. Are you
Okay.
familiar with those medications?
No, can you share with me what those are?
Sure. Your ciprofloxacin is for your pneumonia that
Okay.
you're being treated for. And it looks like you're breathing much better today because you're off the oxygen.
I am.
The other one is metoprolol. That is for your heart. It affects your blood pressure and your heart rate. And
Sure.
we just were in here doing your blood pressure, which was 120/80, and your heart rate was 84. And both of those mean it's appropriate to give you your metoprolol.
Okay.
Okay, so I'm going to go ahead and get the medications ready. Okay. So first, I'm going to scan my metoprolol. Beep, beep. And I have my patient, Phil Sherdoff, 1/6/1967, allergies to shellfish, and metoprolol, 25 milligram tablets. So I have 25 milligrams, 25 milligrams, for a total of 50 milligram dose, orally, given 2 times a day, and dose due now at 9 a.m. So I'm going to go ahead and open those up and put those in for my patient. The next medication is my ciprofloxacin. I'm going to scan that. Beep. All right, and I have my ciprofloxacin 500 milligram tab, and this dose is for 500 milligrams. The route is oral, it's given daily, and it's due at 9 a.m. So I'm going to go ahead and open that up and put that in the cup. Okay, and then I'm going to ask you, Mr. Sherdoff, are you okay using your water that's at the bedside?
Yeah, definitely.
Okay. Do you like to take your pills one at a time or all together?
I'm just going to down the hatch.
Okay, all right. Here you go. Okay. Okay, excellent. So I'm going to go ahead and finish documenting that he took both of those doses, and then I am going to check the bed and make sure that everything is safe. The bed is in a low position. I do see his call light is here alongside of him. Mr. Sherdoff, is there anything else that you need right now?
No, I'm pretty good, Sheila. Thank you for
Okay.
coming in and checking on me.
I'm going to come back in the next 45 minutes to an hour, but if
Okay.
you need something before then, just hit that call light,
Sounds
okay?
good.
All right,
All right,
thank you.
Bye-bye.
Bye.